MMT Wrist Extension, Extensor carpi radialis longus, Extensor carpi radialis brevis, and Extensor carpi ulnaris. Assist the patient to the short sitting position with the feet resting on the floor or on a stool. The elbow is flexed and the forearm is pronated. Both are supported on the table. Stand in front of the patient. Passively extend the patient's wrist. Stabilize the distal forearm, and with the other hand, bring the back of the patient's hand up to the ceiling. You are not assessing the infield. You are determining how much range the patient is able to move the elbow in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to extend the wrist. Stabilize the patient at the distal forearm. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include ulnar or radial deviation and using the finger extensors to assist the motion. Make sure the patient's fingers and thumb are relaxed. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient at the forearm. With your other hand, apply resistance to the dorsal surface of the metacarpals. Your thumb should be around the palmar surface of the hand. The resistance is applied in a downward direction into wrist flexion. Apply the force for a 5-second count. Grade 5, normal. The patient completes full range of motion in wrist extension and holds against strong resistance. Grade 4, good. The patient completes full range of motion in wrist extension but breaks against strong to moderate resistance. Grade 3, fair. The patient completes full range of motion in wrist extension but does not tolerate any resistance. If these conditions are not met, the patient must be repositioned to a gravity-eliminated position. Keep the patient in short sitting with the feet resting on the floor or on a stool. The arm continues to be supported on the table. This time the forearm will be positioned so the hand rests on the ulnar side. The gravity-eliminated position of the therapist is to stand at the test side of the patient, supporting the arm proximal to the wrist. Instruct the patient to extend the wrist, maintaining the fingers relaxed. Grade 2, poor. The patient completes full range of motion of wrist extension. For Grade 1, reposition the patient as for Grade 3 and support the wrist in slight extension. You must now palpate the extensor carpi radialis longus on the dorsum of the wrist in line with the second metacarpal. Palpate the extensor carpi radialis brevis on the dorsum of the wrist in line with the third metacarpal. Palpate the extensor carpi ulnaris on the dorsum of the wrist proximal to the fifth metacarpal and just distal to the ulnar styloid process. Instruct the patient to attempt to extend the wrist. Grade 1, trace. Palpable contractile activity at one or both tendons with no motion. Grade 0, no palpable contraction.